Hi, my name is Gail Scott, and I'm Director of Jefferson County Health Department and the Health Officer for the county.
Hi, I'm Chris Barron, Executive Director of Population Health and Clinical Services for Fort Healthcare.
And we're here today to discuss the current situation for the coronavirus, or what we call COVID-19. It has many different names, and so you might hear it called just the coronavirus.
So Gail, let me ask you on coronavirus. You hear a lot of things on the news. Where should we go for information about coronavirus?
Well, the most important place for information is looking at credible sites. So we suggest the State Department of Health Services or the Centers for Disease Control, or the CDC. We will also be posting information on the Jefferson County website, on our Facebook and Twitter sites. We will get information out through the media, including newspaper media, also radio interviews, and sometimes we are even asked to go on and do live on camera television interviews. But the most important places to look are the credible sites, the CDC and the Division of Public Health.
Excellent. Yeah, we monitor the CDC very closely here at Fort Healthcare, and as information changes, that's where you can find the latest, greatest, best information, cdc.gov.
The CDC is also holding webinars for public health providers and clinicians, as well as we have a weekly webinar, or more frequently as needed, with the State Division of Public Health. So we are keeping up to date, and we have a great relationship with Fort Healthcare. We work with their infection control department, sometimes on a daily or multiple times a day basis. And we also train together and plan together.
Yeah, that's a great point, Gail. Gail and I have worked closely in the past. We're in constant contact. Fort Healthcare is well prepared for a variety of medical events in the communities we serve. So can you tell us what are the best ways to stay safe and not get sick during this time of year?
Great question. And what I want to say is, at the present time, in Wisconsin, it is still considered low risk for people to get the coronavirus. However, there are a lot of other diseases out there, such as influenza, gastrointestinal diseases, that we want to make sure people protect themselves against. And they pretty much involve all the same tactics, and that is wash your hands, cover your cough into your elbow, or cover it up, sometimes cover it up, and make sure that people, if they are sick, make sure you stay home. And by staying home, we mean stay home. And also be prepared if you are ill. It's always good, no matter what's going on, to have supplies and food at home, just in case you have to stay home for a length of time, to protect yourselves and others. And I always emphasize too, you're staying home because you're sick and your body needs time to heal.
Yeah, that's exactly right. Stay home if you're not feeling well. And hand hygiene is so important, and you don't realize how many times a day you touch your face, your eyes, your nose, and if your hands aren't clean, that's how you introduce viruses, whether it's influenza, cold, COVID, those things into your system. So good hand hygiene, wash your hands, use hand sanitizer, clean surfaces, all great advice.
Yep.